And first at 6 tonight, it's being referred to as a quad-demic. The CDC reporting a rapid rise in a number of acute respiratory illnesses in the last month.
Yeah, and while that's to be expected, of course, in the height of flu season, the numbers are still trending higher than average. Webb Wright is here now to talk about what the quad-demic means for you. Webb?
Well, COVID, flu, RSV, and adenovirus, they're the 4 illnesses on the rise that make up this quad-demic. And while most cases aren't severe, they can be if you don't take the proper precautions.
We're definitely seeing an increase in patients with respiratory viruses.
Low-country healthcare workers say they are seeing what everyone else is seeing statewide.
Fall and winter, they start to pick back up because everyone is inside. So definitely increase in RSV, flu, COVID. So we've seen kind of all of those. Flu is definitely becoming more popular over the past few weeks.
The state health department says in the last week of 2024, 8.2% of those seeking care at state health departments were attributed to flu-like illnesses, well above the state baseline of 3.2%.
Patients with fairly mild symptoms, low-grade fevers, cough, sore throat, but we're definitely seeing some patients who come in with pneumonia, maybe need oxygen to help them with those symptoms.
There's also a downturn in vaccinations nationwide, according to the CDC.
Anxiety about the COVID vaccine has definitely gone over to other vaccines, including the influenza vaccine, and I think that's probably contributing to what we're seeing right now. We definitely see a lot of patients who have either heard misinformation about or they're generally anxious about getting the vaccine.
It depends on if the COVID severity, whatever is going around, how severe it is. So some people are hesitant about getting the vaccine if it's not like a very serious strain going around.
Still, they insist vaccines are the first line of defense.
We try to educate people on the safety of vaccines and encourage everyone who is a candidate to get the vaccines and help protect you and your loved ones. We always recommend washing your hands, covering a cough, avoiding sick contacts as best you can, and of course, if you are sick, we would encourage you to stay at home.
Even if you're kind of hesitant on the vaccine for yourself, just think about the people around you and how these diseases can affect them too. So it's about protecting others.
Now, healthcare providers say they've also seen an increase in what's called walking pneumonia, which can be a consequence of getting the flu because it weakens your immune system. Working for you, Webb Wright, News 4.